I'm Rohini Prashar, and I am a transplant nephrologist. I work in Henry Ford Hospital in Detroit, Michigan, and I'm the medical director of the Living Donor Kidney Transplant Program. I did my initial medical training in Patiala in India, and then I went over to do my residency in the United States, and I followed it with a nephrology fellowship. And during my nephrology fellowship, I saw a lot of patients with dialysis. I saw how dismal their life looked. So I just, was attracted towards transplantation, which was just a positive thing in nephrology. It just changed people's life. So I went on, did another year of transplant fellowship, and then I ended up pursuing a career in transplant nephrology. So right now, I work with donors, I work with recipients, and we try and work up donors for living donor transplants. We try and have paired donations. We try and work up chains where an altruistic donor can help multiple people get a kidney transplant. We work with multiple other centers to be a part of those chains. So we work with them medically, surgically, ethically. We try to spread awareness in the society, and that's about it. Good question. So what is preemptive kidney transplantation? Preemptive kidney transplantation is getting a kidney transplant before you start dialysis. So there's this study done back in 2001 and 2002. They looked at what factors impact your survival after you get a transplant. And the strongest modifiable risk factor that impacts your survival after transplant is your time on dialysis. So the more the time you spend on dialysis before you get a transplant, the lesser is your survival after the transplant. So dialysis adversely affects the transplant outcomes. So ideally, you should get a transplant before you start dialysis, because dialysis can cause heart disease, calcification of vessels, and a lot of other complications. But then the question is, how preemptive is too preemptive? So we have a cutoff, general cutoff. Of course, you have to look at the patient, but generally when your GFR, which is your glomerular filtration rate, in diabetics, if it's less than 15, and in non-diabetics, if it's less than 10, that's a good time to kind of get a kidney transplant. You don't want to transplant them too soon, because then you're subjecting them to a surgery, immunosuppression, a lot of things that they don't need at that point. So you just have to find that right window, but there's no doubt that preemptive transplant is better than getting a transplant after starting dialysis. So the surgery wasn't done in our hospital. They haven't disclosed where the surgery was done, but Selena Gomez being such a youth icon, it was a very good chance for us to spread awareness about living kidney donation. And well, the risks involved are not as much. The risk of a living kidney transplant for the donor is actually less than, the mortality risk is less than you dying from a cholecystectomy, which is your gallbladder removal. Actually, if you remove a kidney for a transplant purposes versus if you remove a kidney for a tumor or a stone, your risk of your mortality risk is way less with a nephrectomy done for a transplant. So it's really not a big surgery as far as donor is concerned. Even with recipients now, there are new techniques, there are robotic transplants, so the surgery is really not as risky. What happens is, what follows after that, it's immunosuppression. Immunosuppression is like cancer drugs, it's anti-cancer therapy, so they come with side effects. Infections, cancers, anemia. So that is the bigger challenge, taking care of those complications later on. But if patients take good care of themselves, they're been monitored by a good team, they're taking their medications most of the times, they do very well. So the surgery is not, surgery or follow-up is not as big of an issue. So not only the United States, everywhere there needs to be increased awareness about organ donation, not only living but deceased organ donation. So in the United States, we are of course trying to, unfortunately in the United States, unlike other countries, the living donation rates are very stagnant. People don't donate organs. So awareness about living donation, letting people know that, we say share the spare. You have two kidneys, you can share one, right? So share the spare, spread awareness, let people know they can live with one kidney. At the same time, being very cognizant that we have to make sure that the donors that we select are healthy themselves. We don't want to put them at harm. And then again, deceased donor pool, we have to increase that too, especially in countries like India or Japan, because in these countries it comes with donating organs comes with a taboo. In Japan, they don't donate deceased organs. All their organs are living donor transplants, most of them. So I guess spreading awareness in the society about organ donation is the key. So there's a lot of push towards incentivization of organ donation these days, which means pay people for donating their organs, right? People who argue against this say, there's no need for it. Why don't you fix the system and don't swap it for free market, which is reasonable, because if you are paying money for an organ, you're kind of undermining a very essential component of organ donation, which is trust, right? So that pros to it, there are cons to it. The ideal way would be to come up with a regulated system of incentives in the whole organ donation framework, right? So there's less room for organ trafficking, there's less room for illegal trade, but at the same time, there's a way that our donors don't feel pressurized, right? So the ideal way to do that is removing the disincentives. Don't pay the donors, but at least pay for their lost wages. If I donate my organ, I'm taking 6 weeks off from work, right? What will my children eat, right? Where will I get the money to pay my bills? So the ideal way would be maybe to remove the disincentives. Paying someone, it has its cons, but that's where I think the transplant community is headed nowadays. At least remove the disincentives in organ donation. I think it's not enough awareness. First of all, awareness about kidney disease. Like I said, by the time your creatinine is 2, which is a measure of your kidney function, you've lost half of your kidney function, right? So after that, it's just a downward spiral. People need to be aware right from the beginning, not only kidney disease, risk factors for kidney disease, diabetes, hypertension. You have to control those so you don't develop kidney disease or catch it early, right? So that's the awareness is the key, in prevention of kidney disease, and if you have kidney disease, organ donation. And like I said, both deceased and living organs. So like I say, I specialize in living organ donation. So really to spread the awareness, to come up with innovative ways and means. We try and build chains. We try to do, so not everyone is compatible. There is ABO incompatibility and there's HLA incompatibility. So not all people who come forward can donate to their loved ones or people they intend to donate to. So we try and swap. So one person who is incompatible with the other can swap their kidney with other incompatible pair, and we can do chains. We can go forward, do chains. The biggest chain that I know has been done is like about 53 transplants starting from one altruistic donor, and it was spread across the country. So something like that. And the other thing is definitely, like I said, increasing organ donation rates by having a good system for incentives and removing disincentives for organ donors, and then at the same time being ethical. In our quest to increase rates of donors, you don't want to resort to unethical practice. I don't want to take a kidney from someone who is hypertensive or someone who is at risk for kidney disease or someone who has a risk for developing diabetes in the future or has family history of kidney disease. So at the same time having an ethical practice. So the problem is kidney disease is going to become an epidemic soon. It's already an epidemic. It's going to assume alarming proportions, because what's the cause of kidney disease? Diabetes, hypertension. The rate of diabetes is, India has the highest growing diabetic population, and it's going to translate into kidney disease sooner or later. So we have to have some measures in place, first of all to prevent it, and once people have it, to treat it. So of course dialysis is going to help. One thing that we have to stress is peritoneal dialysis is a better modality for dialysis than hemodialysis, and it's easily doable. People can do it themselves. They don't have to go to the center. All you need is a little bit of education, a sterile environment, someone to help you with dialysis. So that is something that needs to be promoted. And secondly, organ donation needs to be promoted. I know some centers in South India, they have a good network of deceased organs, where organs become available to people on the list. In the United States, they have a united network of organ sharing, which is a countrywide system. So any person who passes away and is willing to be an organ donor, the organ is brought up to a united network of organ sharing, and the organ is allocated based on whoever is on top of the list. So that leaves very little room for illegal market, illegal trade. So something like that should be implemented in India on a national platform.